My name is Anthony Skalak. I'm one of the orthopedic surgeons here at Orthopaedics East and Sports Medicine Center. I was born and raised in Ohio and did all my training in Cleveland at Case Western Reserve. I then moved to North Carolina where I did a trauma fellowship in Charlotte and subsequently moved to Greenville, North Carolina as a orthopedic trauma surgeon with Orthopaedics East and Sports Medicine Center. I originally became interested in orthopedics just in the sports activities that I did growing up. That was kind of the only doctor that I would see would be the orthopedic surgeon on the football sidelines. And as I kind of aged in my career, that was really why I went into medicine. It was what I wanted to do growing up. And as I went through training in orthopedics, I gradually evolved into having a large interest in taking care of fractures in orthopedic trauma. To me, an orthopedic trauma is a bit of a unique field in that it kind of affects everybody. Nobody really plans on, nobody really picks their trauma surgeon out of a book ahead of time and kind of has them on standby. So frequently I meet people that they've never met me, and I had one mentor tell me that we have the honor and privilege of taking care of patients at the worst time of their life, and I really do feel very strongly about that. I've been lucky enough to have a very good relationship with a lot of patients and be able to walk them through some very hard times. To me, some of the most rewarding times really though are helping people get back to what they are in life, getting them back to their work, getting them back to their recreational activities they like to do. I think there's a couple of very challenging things. I think that frequently we're not giving good news. You have something that is going to change ultimately your ability to function, your ability to do things that maybe you really enjoy doing. And so giving people honest answers and giving people insight to what that will mean and what that will look like from the forefront. I have the foresight and kind of the knowledge to know what this is going to look like at 3 months, at 6 months, at a year, and really to set expectations in a realistic manner so that they're satisfied with their outcome and that they can appropriately manage their life and their activities accordingly. One of the things that really attracted me to Greenville was the size of the community compared to the scope of the medical care that's here. The opportunity to have such a large medical center that in turn leads to very complex and very difficult cases that really require a high level of expertise is one of the things that really brought me here. I feel very happy to have a community that is small and it's a great place to raise my family and yet have such high level medical care really right around the corner.